I get wings to fly. Oh, I'm alive.
Howdy, my friends, and welcome to Forever Young. Carrie Nosler here, along with Kelly Cappasola, and our special guest today, Dr. Gustavo Ferrer. He is an experienced pulmonologist. He's trained both in Cuba and in the United States, and he's founder of the Cleveland Clinic Florida Cough Center, and he's also president of Intensive Care Experts based in Weston, Florida. He's an authority on respiratory ailments, has more than 20 years experience. Dr. Ferrer grew up actually in a culture that effectively utilized herbal teas and folk remedies for coughs and colds, and that is actually outlined in his new book, Cough Cures, the best natural remedies and over-the-counter drugs for acute and chronic cough. The book challenges our Western mindset that unfortunately often results in over-medication. Dr. Ferrer offers a blend of Western and natural remedies to effectively address both acute and chronic respiratory issues, and he is our special guest today on Forever Young. Dr. Ferrer, thank you so much for joining us today.
Oh, thank you. Thank you for having me.
Yes, we're very lucky to have you. And, before we bring anybody on, we definitely check the book out. And let me tell you, Cough Cures is a fantastic book, and so grateful that you took the time to put that together, because I think it'll shed some light on a lot of questions people have when they sometimes will just give up and reach for either over-the-counter medication sometimes or pharmaceutical grade types of things that they may not need without knowing the answer. So really excited to have you on the show today to shed some light on this topic, Dr. Ferrer.
Oh, thank you. Thank you very much. It's my pleasure.
The big question of the day is, how did you end up here in the States as a specialist on respiratory ailments?
Great question. Yes, I grew up in a small town in the hillsides of Guantanamo, Cuba. That is about 40 miles from Guantanamo Bay, actually. In a small town, 700 people, and we don't have doctors. And even today, there are 30% of the people living all the way to the 80s, late 80s and 90s and 200s. My grandma was kind of a healer in my town, and she knew every plant, and they had remedies for everything. We never went to any doctor for cough and flus and so on. I went on to study pulmonary medicine in Havana, Cuba, spent some time as a homeless, and joined the United Nations University in a research program in the Orinoco River, and from there came to the state in the early 2000s, and went on to take the boards, learn the language first, and then take the boards in the different exams, and went for residency in Texas, and then fellowship training in pulmonary, George Washington University in D.C., and from there joined the Cleveland Clinic.
Wow, that is quite a resume, and obviously would give you an opportunity to gain insights into both your native land and the way the folks there practice medicine, and of course what you have experienced as a doctor and a scientist here with the American medical system. So give us an idea of how these two systems kind of either work together or it sometimes might be at odds.
Well, I love Western medicine, and I grew up dreaming to become a doctor and be a practitioner of Western medicine. But as I grew into my medical practice, even in Cuba, I realized that many of my professors were preaching one thing and practicing another one. When it comes to the natural remedies and remedies for common ailments and common problems, they were using teas and they were using all the other things that, everybody uses. And when I came to America, I was shocked to see a great movement coming into it of the natural remedies and trying to find the right place for them. And so what I see is that we have made a lot of advancement in treating, severe chronic conditions, but somehow along the way we neglected these common issues that we get: back pain, cough, which are the most common reason for people going to doctors and hospitals worldwide. So, that opened the door for us to have thousands of over-the-counters that they're minimally regulated, or they, research backing them up is limited, and many times, there are evidence that they're harmful, and that was the reason why I jumped into the idea of putting this book together.
Doctor, do you also think that the reason there's not as much research as perhaps other scientists would like is that there's, in some cases, just not much money to be made in natural remedies?
The remedies that we recommend, they do have research, and even more than that, many of them have the test of time. That many of our medications and drugs that they've been tested, they have a lot of research and a lot of money to do the research, but they've been tested over a period of 6 weeks or 8 weeks, and we take them for, that they're going to be a panacea and they're going to solve the problems. And, when time passes, we realize that they are not so good as we thought. Many natural remedies have been used from generation to generations, and they have the evidence of time, number one. And number two, they do have significant amount of evidence, which is true what you said, that unfortunately that there's not a lot of, financial backing to do research in these natural remedies, because the organizations and pharmaceutical said is that the profit margin for them will be too little. Unfortunately, that is an issue that we all have to face.
Yeah, absolutely. And I think that's why it's so exciting that you took the time to take on such a massive project as the book Cough Cures, because I read it, I looked over it, and there's some wonderful foundational information that you put in there. So tell us a little bit more why you made the decision to take on such a big undertaking as being one of the people who wrote Cough Cures.
Well, actually, the inspiration for that is my wonderful, beautiful wife. I was a fellow in pulmonary medicine in Washington, D.C. She was taking care of our kids, and the kids were toddlers, and during those times that they have cough almost every other day, and they have flu and runny nose constantly. And so I was in my training, working an excessive number of hours, and she was taking care of the kids, and she was the one going to the pharmacy. And every time I saw one of the medications that she brought, I told her many times, there's research proven that they don't work, and this could be dangerous. And so until she told me one day, well, why don't you write something and you guide me through this, and to the shelf of all this over the counter. And that was basically the origin of the idea of writing the book. And from there, we start pulling out research and going to conference and digging more into these issues. And that was basically the origin.
Well, I definitely want to talk more about the book, but a basic question. I mean, it sounds kind of silly or maybe too simplistic, but Doctor, why do people cough?
Actually, we have that in the book. We cough because cough is a protective mechanism. It's actually, and to some extent, cough is good, because cough was created for us to get rid of dust, fume, vapors, and things that get into our lungs. The lungs is like a big skin that is exposed to the oxide. So any irritant that goes into the windpipe, we need to cough them out and remove them. And when we build up phlegms, we need to remove them. And that's the reason that we cough. It's a protective mechanism.
So then what would be the difference between using a natural medicine, as you outline in the book, Cough Cures, and some other kind of over-the-counter or even pharmaceutical remedy for cough?
Great question. By far, most of the medications that we have are drugs available over the counter to treat cough, and even prescription medication, they are blocking the cough reflex, but they are not actually treating the cause. With the natural remedies, what we did in our book is that we go and try to treat the origin of the cough and find the reason for the cough and try to treat it with natural remedies. If the cough is related to acid reflux, we use specific natural treatment for that. If the cough is caused by dripping, postnasal dripping, well, we use a specific natural nasal spray for that. So that's what we're trying to do with the natural remedies.
Okay, so then what are some of the things that people can do at home to find relief from cold and flu symptoms, as outlined in your book, Cough Cures?
Oh, we have great tables in the book that summarize, the things that people can do. It will depend on the cause of the cough. Most of the chronic cough are usually due to smoking. That's the most common reason. But if we exclude smoking, the second most common reason is going to be stuffy nose, runny nose, post-nasal drip. And we heavily recommend in our book the clear nasal spray, which is a combination of normal saline, salty water, and xylitol, which is a natural remedy, which is phenomenal. There are evidence behind that they kill bacteria, that they normalize the pH and protecting the nasal passages. If they have acid reflux and so on, we recommend specific protocols to treat the acid reflux. For those cough that they are persistent in kids and so on, we have some soothing treatments that they have evidence, behind them. We use teas that include ginger, and lemon, and honey in the appropriate combination that will be helpful for cough, even acute or chronic coughs.
Great. And we have to run out to a break, Dr. Ferrer, so when we come back, we're going to pick that up. Listeners, head over to our website. That's foreveryoungradio.com. Again, foreveryoungradio.com. Click on our weekly highlight page. You can learn more about Dr. Ferrer and his wonderful book, Cough Cures. We'll be right back. Don't touch that dial.
I get wings to fly. Oh, I'm alive.
Welcome back to Forever Young. Kerry Nosler here along with Kelly Cappasola. Our special guest today, Dr. Gustavo Ferrer. We're talking about natural remedies to help people with coughs and, of course, his book, Cough Cures, Kelly, which, as you said, contains a lot of great information.
Hey, I love it. You know me, we get a lot of books around here, Carrie, and, you can skim through it, you can check it out. Because of issues that I've had in my family with asthma or different types of situation, it was something that I really wanted to take the time and go through this book. And we're so excited and blessed by Dr. Ferrer, who's agreed to give the first 5 listeners who send me an email a free copy of Cough Cures, which is a gift in itself. So all you have to do, the first 5 listeners to email me at kelly@foreveryoungradio.com. Again, that's kelly@foreveryoungradio.com. Email me your name and address. You will get a free copy of Cough Cure. So, again, we'll say that a couple more times throughout the show. I'm sorry, the first 5 gets it. We'll alert you as soon as we know. We'll timestamp it and, enjoy the book and share it with your friends and family, because that's what it's all about. Now, we briefly talked about it before we went to break. Dr. Ferrer, in your book, you recommend one of your favorite products, and that's clear nasal spray, and that's something we've talked about on this show for, 6-7 years now. So what is it about Clear that you liked? How did you come across Clear, and how does it work for your patients that you've actually seen in your setting of practice?
That's a great question. For years, we all pulmonologists have used normal saline, salty water to treat, nasal stuffiness and post-nasal drip. And we even give it to our patients to humidify the nasal passages when they're using oxygen, or they're using even the BiPAP, the mask that we put for people that have sleep apnea. But for years, patients come to us and they tell us that, many times the saline tend to dry the mucosa, the linings of the nasal passages, and people tend to bleed after using this several times. And the reason is because salty water has a low pH, it's kind of acid, and will burn down if we use it several times. I have a wonderful friend who is the co-author of my books, Burke Lenihan, and she was using the Xylitol for many years, and she was the one that reported to us years ago that it was an excellent product. So we started using the product in our patients, and we saw quickly the results. And today we recommend it widely, and we use it in my own family. I use it with my kids. I have a daughter that she has post-nasal drip, which is by now cured, but we use it from time to time when we travel, xylitol, we use it when she gets a little bit of a stuffy nose from the school or the dryness of the air conditioning. The beauty of xylitol is that it has research backing up the effect that is antibacterial. It normalizes a little bit more the pH and tend to be good or ease in the nasal passages, and so we find that patients and overall people find good relief when they use the xylitol compared with most common saline and other nasal spray that are available. It's a natural product and is highly effective.
It is non-habit forming. And I think some of the other ones on the market, people will say, oh, I had a little bit of trouble with that a couple of years ago. It became a habit even when I didn't need it. And I think that that's what we need to look for. When we talk about xylitol, and Carrie, you can add credibility to this, but it's naturally occurring already in the body. It comes from things like mushrooms and certain fruits. So even though xylitol often sound like it's a chemical made in some type of a lab, it's a natural type of nutrient that is just out there in the world. So don't let the name fool you, right, guys? Xylitol can sound a little chemical-ish, but it's not.
Absolutely. And Doctor, it's just amazing to me when you start outlining the benefits of xylitol. It almost sounds like it's too good to be true. I think initially it received a lot of attention for its ability to help retard problems with the teeth, cavities and different types of situations like that. And you're mentioning coughs, and we've also heard it recommended for to help children to avoid things like ear infections. So you mentioned antibacterial, but as I understand it, does it do this because it helps to break up biofilm so that the bacteria just can't adhere to surfaces? That's correct.
It breaks down the biofilm that forms in the nose or in the nose passages and prevent for the bacteria to get adhered to the mucosa and then develop infectious process from there. We're going to see a good number of research and coming up in the following years on xylitol. I know that last year the American Academy of Ear, Nose, and Throat Doctors, they added for the first time a recommendation to do nasal rinses into their guidelines for people with chronic rhinosinus problem, and is moving quickly to be recommended in acute problems, which is by far the biofilm that it gets formed in the nasal passages is responsible for all the issues that we get. The dryness that comes after those biofilm forming, when we blow our nose hard, that biofilm comes out, but it peels off the mucosa, and we get ulcers in the nose, and those break in the nasal passages are the one that opens the window for bacteria to get through and then develop infectious process.
If someone has been using different types of medications that, again, just treat the symptoms, and you start to use xylitol, what kind of a time frame can you expect to see some kind of difference?
I have reports from patients and close family members that they have seen results basically in a couple of days. Others with more chronic issues, they see it in a week or so. I have patients that have I have patients on my clinic that they've been coughing for 30 years, 40 years, with severe rhinosinus problems after surgeries, which damage all the mucosa lining, and they have been using multiple prescription nasal spray, and basically the skin lining up the nasal passages and the posterior part of the nose right behind the tongue, they are burned and they are damaged. And I have used successful in those patients over a period of a week or two, gradually adding the xylitol a couple of times, the clear a couple of times a day, and sometimes up to 3 times a day, and then winning down the prescription medications, and they've been successful.
I think the fun part about it is sharing it with family and friends, because that's when you really know if it's working. And when they say, whoa, what is this stuff? That's exciting. I've given it to my little niece who's 2 years old, who was having chronic, runny noses, chronic ear infections. And then even a neighbor, Caroline, she is in her late 60s, had, to have her thyroid irradiated. It created her to have a chronic cough after that surgery. She was put on a nebulizer every night. And so I said, hey, your allergies are high. Try this. Wash your nose. And she said, okay, I guess I'll give it a try. And it's one of those things where 2 days later you get a knock on the door saying, what is this stuff? And at the time I gave her a copy of Dr. Jones's book. And as soon as I was done reading Cough Cures, it was the next thing I gave to her. So, these are topics that are meant to share, especially when we're talking about our little ones. We all fear September when they all go back to school, or even our little ones who are in daycare. They're always bringing home something, and it's generally not a colored picture. It's some type of flu or some type of, chronic cold that the whole family is going to then get. So, taking the time, and, one of the things Dr. Jones has taught us on this show, when you wash your hands, wash your nose. And that's how easy it is to use Clear nasal spray. And for those of you who are looking and maybe can't listen to the entire show, you can find Clear nasal spray all across the country. You can find it at different places like Whole Foods, vitamin shops, Sprouts, and other fine health retailers across the country. Also, Target, CVS, and Rite Aid have it. And for listeners who would like a complete list of retailers in your neck of the woods, in your neighborhood, you can go to Xlear.com. That's Xlear, Xlear.com. And you can spend a little bit of time on that website, learn a little bit about what's going on. But I highly recommend that you get yourself a copy of Cough Cures. Now, I mentioned briefly before at the beginning that the first 5 listeners to email me at Kelly@foreveryoungradio.com. Again, that's Kelly, Kelly@foreveryoungradio.com, will receive a free copy of Cough Cures by Dr. Ferrer. So please, if you could email me, make sure you include your address. The first 5 people will get a copy of that book. But for those of you who are listening and you're really liking what you're hearing, I also encourage you to go and check this website out. It's GustavoFerrerMD.com. That's GustavoFerrerMD.com. And for those of you driving, don't worry. We've added this to our weekly highlight page at ForeverYoungRadio.com. Hit that weekly highlight page. Everything we're referencing on this program is located there. Now, Carrie, Dr. Ferrer, we have to run out to a break. When we come back, we're going to hit a lot of good things. I'm interested to talk about more about Cough Cures and go over why antibiotics don't work for most colds and coughs. I think that'll be a very interesting topic to cover with our listeners today. Listeners, don't touch that dial. We'll be right back after the break.
Mom, my nose is stuffy. Can I have some Clear?
Sure, honey. Wow, your child actually asks for nasal spray? My kids hate the chemical taste. Well, this isn't a chemical spray. This is Clear. Clear? Yep, Clear, spelled Xlear. It's the natural nasal spray made with Xylitol. It has no chemicals, so it's perfect for my whole family. How does it work? Naturally. One spray is all it takes. My kids ask for it because they know it works fast, and they even like the taste.
All done.
Do you feel better?
Yep, thanks, Mom.
Why hasn't my doctor talked to me about Clear? Good question.
Made with xylitol, Clear, spelled Xlear, is the natural nasal spray that's perfect for adults and 100% safe for kids. Clear alleviates congestion caused by colds, allergies, flus, and pollen and dander. One spray is all it takes to keep your entire family clean and clear. So ask for Clear by name. That's Xlear at fine retailers like CVS, Whole Foods, Vitamin Shop, Sprouts, and Kroger's. Or find a retailer near you at Clear.com.
I get wings to fly. Oh, I'm alive.
We're back with more on Forever Young. Carrie Nosler here, along with Kelly Cappasola, thanking you all so much for joining us today. And our special guest, Dr. Gustavo Ferrer, and I just know that you are learning a lot about something that I don't think people think a lot about, coughs, but as Dr. Ferrer said, a major problem and consideration for many people in the country today. And obviously, Doctor, you have a lot of things in Cough Cures, and you tackle some very interesting questions that people have to face every day. And one of those concerns antibiotics. We know that they do wonderful things and have saved a lot of lives. Fortunately, now we have a problem of antibiotic overuse and sometimes not being prescribed for the particular problem, or finding that the particular problem they're prescribed for doesn't really seem to be that effective. How do antibiotics enter into the picture when we're talking about coughs?
Antibiotics, as you mentioned, they are phenomenal. They have changed history of medicine. But unfortunately, in the last 10 years, we're facing a crisis of antibiotic-resistant. Common bacteria are becoming really hard to kill with the antibiotics. And the origin is that we have used too much antibiotics and we have abused them. One of the most common reason, or the most common reason for antibiotic abuse is actually cough related to common colds, flus, and in the winter season. And what we get out of this is that most of these problems that we get with acute cough or even chronic cough, the great majority of them, in excess of 90%, they're caused by viruses, and antibiotics do not. They do not kill viruses. So they don't kill viruses, so antibiotics do nothing for those viruses. So when we take the antibiotics for an acute cough, we're basically just taking a sugar pill that will do nothing for what we have. But that sugar pill, which is the antibiotic, has a lot of side effects. And one of them, it can kill your normal bacteria in the intestine, which are in turn responsible for the defenses, the immune system, and also can be recognized by the bacteria that they're living in our respiratory system, in our nasal passages, and then those bacteria can become resistant to these antibiotics. The World Health Organization said 2 years ago, last year actually said that we are facing apocalyptic times when it comes to antibiotics. It takes in excess of 10 years to have a new antibiotic come to the scene, and we're seeing more and more common bacteria developing resistant to these antibiotics.
Health professionals, scientists who go through a lot of training and know that antibiotics don't help with viruses, so why would they be prescribed in the first place?
Excellent question. Actually, in the last 2 years, there are plenty of studies looking into exactly the same question. And here's the issue. The issue is that, unfortunately, we have nothing to offer in conventional medicine to the patients with acute cough. This is another good reason why we decided to write this book, to show my colleagues and the general population that we have a lot of great things other than antibiotics for acute cough. So we have nothing. The medicine is at really fast pace, and the doctors will go into it and they see the patient. Many times patients ask doctor for antibiotics. And there is a recent study that shows that 9 out of 10 doctors that you ask them, will the antibiotic do something for your patient? 9 out of 10 doctors will say, no, I give it because I have nothing else to give them. So this is the key, and this is one of the reasons we put together this book, Cough Cures.
That's fantastic, because I think some of the doctors feel pressure like, hey, if I don't give them anything, they may not come back to me as a doctor. And, so it's one of those things where they're trying to appease the patient, but unfortunately, that's when the patient will go to other things like, we talked antibiotics, cough syrup, or even pain and sleep medication. And I can tell you years ago, when I would get my annual little bronchial issue, I would go into, your local pharmacy and pick up something that, was like a little pink pill, and it's supposed to help you with everything, but then you wake up the next morning, you feel lethargic, you feel drowsy, and I can tell you as a clear nasal spray user for many, many years, I have never felt that way. I want to also talk about the importance of sleep. If we have a loved one, whether it's our husband or our wife, and they're a chronic cougher, and we then, we share the same bed with them, we're going to sleep, it is disrupting our sleep as well. So even if you're someone who maybe doesn't have coughing issues, but your loved one does, bring them to the radio and get them a copy of Cough Cures, which they can get at either Amazon or Barnes & Nobles, because this is an issue that doesn't just affect one person. It can do this triage effect where everybody is then affected by that chronic cough.
That's right.
Just what do you hope will happen with folks reading Cough Cures? What kind of results are you hoping that it will accomplish?
What our hope is that we gradually teach our colleagues, my colleagues, doctors and nurses and practitioners, that there are enormous amount of evidence for those good natural remedies out there that we can use for acute cough. One of our main goals is to educate the part of the family that goes to the pharmacy, moms and caregivers. They are the one that go to the pharmacy and buy over-the-counters. Unfortunately, the industry of over-the-counter for respiratory remedies or medications last year closed into being a market of $7.7 billion. And our goal and our hope is to teach our patients and family and caregivers that we can actually save money, save time, and use very effective and safe remedies, and by the same token, live a healthier life.
I think it's fascinating when you said part of the reason you wrote the book was to educate your own colleagues. I would just wonder, obviously your credentials are impeccable, so how have they reacted? What have you heard from your fellow doctors about the information in Cough Cures?
That's an excellent question. I got to tell you, this is the first time that I'm going to say this in a radio show. I was very skeptical in the beginning to speak about my book with my colleagues, okay? Because I thought that they're gonna shut me off. It has been totally different. Everywhere I go, we have an incredible acceptance, and people actually asking us to put the book in their practices and so on. My biggest example was last December. I spoke at the Cleveland Clinic Wellness Conference in Vegas, and it's a conference just directed and addressing doctors and nurses and nurse practitioners, and we have hundreds of people asking us to continue to do what we're doing. So it was very refreshing to see that. I have spoken in group of doctors and clinics and conference ever since that time, and every time we talk, people are dying to see something like that.
Wow, you're such an amazing man, Dr. Ferrer. Thank you so much for being our guest today. We'd like to remind our listeners that they can get a copy of your book, Cough Cures, at Amazon.com or also BarnesandNoble.com. It's great reading. As far as clear nasal spray, as I mentioned, it's available at Vitamin Shop, Whole Foods, Sprouts, and other fine health retailers nationwide. And you can also find it at Target, CVS, and Rite Aid. If you'd like a complete list of retailers, that can be found at Xlear.com. That's Xlear.com. Dr. Ferrer, wonderful time with you today. We really appreciate the time you took as a very busy person educating people out in the world. Will you come back? We'd love to have you back on the show.
Absolutely. Thank you for having me, and please check my website, GustavoFerrer.com. You're going to find lots of good information, videos, and blogs that they're full of educational facts.
Fantastic. And you can find that direct link on the weekly highlight page at foreveryoungradio.com. Thanks for the time, Dr. Ferrer, and we'll talk to you again.
You're welcome. Thank you.
Well, Carrie, that was a really good show. I mean, I like the topic because who's really talking about coughing out there? You're not hearing it on a lot of shows.
Well, I think it's exactly why Forever Young is the program that it is, so that you can get those kinds of issues dealt with that, again, so common. Who thinks about a cough? You cough, big deal. But as Dr. Ferrer said, it's one of the major reasons that people have to go to see doctors. So it's something that we have to deal with. And as he said, it's really a systemic issue. If you have a cough, you just don't want to stop coughing. You want to do something that's going to enable the body to have the strength that it needs to naturally handle those kinds of situations. And that's what we talk about here. So I just loved it. I thought it was great.
Yeah, I was blown away when he said, like, some patients who come to him had a cough for 30 or 40 years. I mean, that is pretty intense to be able to be put in a situation like that. And, yeah, adding the clear nasal spray into my life has done wonders for me. I was a chronically sick kid who had ear infection, adenoids issues, and, it's one of those things that you just take something so simple and inexpensive, you work it into your family's lifestyle, and just how much joy it can bring, in adding that type of supplementation. I will do one disclaimer because we all know that I'm a foster failure and have tons of dogs. Xylitol is deadly to dogs. So if you do use the clear nasal spray, please keep it up on a shelf. Again, all the information we shared today can be found at our weekly highlight page at foreveryoungradio.com. Have a great rest of the week. We'll catch you next time.